Hello and welcome to another edition of GNAT-TV's In-Depth series. I'm Andrew McKeever, the news director here at GNAT-TV's News Project, and it's a pleasure to have you with us today. Also a pleasure to be joined here in the studio today by three folks from BPI, or Bennington Project Independence, an adult daycare and rehabilitation service agency located down in Bennington, just on one side of Harwood Hill down there on Route 7A. And it's for adults over the age of 18 who may face challenges associated with aging or disability. You don't have to be a resident of Bennington to go there, so therefore it's great to have you three here to tell us a little bit more about what BPI does for our viewers who may have an aging parent who may be in need of your services. By way of introduction, we're pleased to have Linda Putney, who is the president of BPI's board. Linda Wichlak is the executive director, and Dr. Aruna Spudnikas is a member of the board. Thank you all for making the time to be with us today and tell us about BPI. And just to get us started, Linda, why don't you give us the overview of what BPI does? What are some of the programs you offer and the things you do down there on a typical day?
Well, that's how long do you have?
About 27 minutes.
27. Well, Bennington Project Independence came from the trying to help people be as independent as possible, and so obviously we incorporated that in our name. So many of the programs that we have are really designed for the people who attend the programs. So we have people age 18 and over who come. We have very independent seniors who just want to get out and enjoy life and activities. We have lots of things going on for them. We have people who are much more physically handicapped, post-stroke, MS, where it's a delicate medical condition where they may need some assistance, but they want to do the same things that you and I want to do and get out and enjoy life. And we have people with cognitive issues who may need a little bit of a different sensitive care to help them be as independent as possible. So a day at BPI is very, very different for everyone. We offer between 20 and 25 activities a day for people to pick and choose from, and it's really based on the people's lives. We try to bring their lives into the program. So it might be, we have nursing opportunities for people who might need some care and support. We have social workers. We have a social worker who is able to help people maybe sort through or navigate through the system. It's very helpful to have a little helping hand. We have different activities that are offered throughout the day. We're starting our basic Tai Chi class, which is open to the public, and that's going to be starting in September. So if anyone's interested, they can contact us. And the activities range from very social activities to physical activities, activities to keep people mentally stimulated, and just to have fun. We are party animals.
All right. Well, so the basic idea then is this is a place where folks can come, spend the day, hang out, socialize with other people, get out of their house, and just, kind of not be a shut-in, basically. That's the basic concept, I gather.
Absolutely. So it came from the same need as an alternative to traditional nursing home care. We're not anti-nursing home. We're just an extension of the long-term care system. Some people may need the assistance of a nursing home, and some people may not. So we do have a wide range of people, obviously, who attend our program. And so they can get the care and support they need to help them, again, be as active as possible. It's always something different at BPI, and we're always growing. Sometimes people are concerned that they don't want to be with those old people. Well, old is just a matter of our spirit, and we want to keep people, we try to fan the spark of life.
So how many members do you have currently at BPI?
Well, we have approximately 105 people enrolled in our program right now, but not everybody comes every day. People set their own schedules.
Okay.
1 day a week, 3 days a week, 5 days, 5 days a week, a few hours a day, whatever it is that they need, and their families need to help them again, be as active and get the most out of their lives. And it allows the family members to have an opportunity to take care of the other important things in their lives besides caring for their loved one, to be able to work and take care of their families.
Linda, Dr. Badnikas, how is elder care changing as you've watched it from your vantage points on the board? How is that evolving compared to, let's say, 10, 20, 30 years ago?
Well, I mean, our society is completely changing. It used to be that elder care was provided in your own home. I mean, you had several generations living together, and now because people are so mobile, you don't have that anymore. And so consequently, a lot of the adult children may live somewhere else, and then the elderly parents are living kind of on their own, and they may do well for a while, but inevitably something will happen, either some kind of a medical issue or a social issue of something occurs, and then the family is in a crisis, and they have to decide, well, what are we going to do? And it's the old sort of aspect of keeping them at home was, well, we can't do that because I have to work, we have the kids to get off to school, and what are we going to do with grandma and grandpa? And the knee-jerk response then was, well, I guess we're going to have to put them in a nursing home. And as Linda said, sometimes that is the only alternative you have, but it's not the best alternative for a lot of people, because a lot of people, I've seen this happen as a physician, that you see them actually deteriorate sometimes, just because the staff are just overwhelmed with the things that they have to do for really medically difficult patients. But something like BPI, where you have essentially a respite, sort of allows the families to not have to worry about grandma and grandpa, that they're safe, they're being well cared for, they have nutritious food there, again, these activities that stimulate them, and it keeps them, healthy. And one of the things that people need to understand is that health is not just the absence of disease. To be healthy, you have to have all the aspects, the social aspects of interacting with other people, keeping your mind stimulated and keeping it as sharp as you can, keeping physically moving and doing things. That's where the Tai Chi comes into place, the balance and things. So I think people are trying to move from the nursing home type care, which is very expensive, because most people don't have long-term care insurance, and it becomes a real drain financially on people. So keeping people at home or in a situation where they can stay at home in the evenings but can go somewhere during the day really is a solution to that problem, and I think it's a preferable one, I think, for society and also for the people themselves, because people would rather be in their own home environment rather than being put into a new situation that they are unused to, and people that they don't know, and I think BPI really serves a real good purpose in that area.
That's really interesting. Is there some criteria you have around who kind of is a good fit for your place, or maybe after you've done an interview or however it is, you kind of interact with people who might be interested there? You say, well, we don't think you'd be the right fit for here. Is there some kind of dividing line in your mind that kind of says, yeah, this person would be good for us and would be good for them, or not?
Well, the basic criteria is that we are serving adults, so it's age 18 and over. Right now, our youngest is 30 and has been with us since that person aged out of the school system and joined us, and has been with us for many, many years. And our eldest right now is 102.
That's quite a range.
Quite a range. So it really is, it depends on what the individual needs. And as long as they're an adult and they want to be active and be part of the community, and they're not potentially injurious to themselves or others, they're welcome at BPI. We do our best to try to find funding sources for them, because we are in a VA Adult Day Health Center. And we do accept Medicaid and other types of things like long-term care insurance and things like that. But our social worker is wonderful about helping people find supports and services that they need to access the program. But from a criteria purpose, it's just if we can help them get the most out of their lives, then they're welcome. And we will do our best to work within their needs and their time constraints. As I said, they establish their own schedules. And then we work with the public transit provider. If it's for transportation up here in the North Shire, we have our own vans in the South Shire, and trying to match things together to make it a seamless experience for people.
Okay, so you do have vans that run up this end of the county and would bring the members down to Harwood Hill and. Okay.
Yeah, we have our own vans. We have only 3, but so we rely on the Green Mountain Express for transport down here. We actually have quite a number of people who come from the North Shire down to our program. Sometimes families will bring people down because they may be working in the Bennington area, or there's a wide variety of people and ways they can access our program.
Linda, I just was wondering, from your standpoint on the board, what do you see as the biggest challenges facing organizations like BPI at the moment? Is it staffing or insurance or?
I would say that when BPI started 40 years ago, there weren't other, except for perhaps Vermont Nursing Association, there weren't many continuing, what would they be called, retirement communities and home health agencies, private ones. So people have more choices now. And my mother was in a private assisted living facility in Florida, but she needed to come north to stay with us. And we were able to use the services of BPI for her, which just worked out beautifully. And that was over 10 years ago. And we wouldn't have been able to keep her with us if it hadn't been for BPI. But the competition in terms of the other opportunities there are more than they were then.
And it's sometimes helping individuals and families know that there's lots of supports out there. So the competition is good, as well as, helping people understand that just because they have in-home services, say through home health, which is wonderful, but that nurse may only be, or that aide may only be able to go in for an hour or 2 a day. And then that individual may be left home alone, or again with the family and the stresses. So it's not the level of support. But when you add adult day with, say, in-home care, then you can kind of get the best of both worlds. The family gets support, the individual gets assistance with the care they need, and then they have a wider range of things to keep them socially active and mentally stimulated. And it matches together very well and has been very successful for many families.
I was wondering, have you ever thought about having a 24-hour residential division within BPI to go along with the daycare aspect, or is that just trying to do too much?
Well, now I can't speak in front of the board here. I don't think we've really considered 24-hour in terms of residential, though many people who come to the Dr. Richard A. Sleeman Center on Harwood Hill, our beautiful center, they ask if they can live here because it is so nice. But 24-hour adult day is something that may be in the future. Long range, but we have some wonderful assisted livings. We have wonderful nursing homes in the area. We're not looking to duplicate effort. We're an extension and an option for people.
Another big issue, I think, with the board, as being a board member, that we always are discussing is funding. That's the primary issue is trying to get enough, because we have fundraising efforts and we have things that we do to try to add to whatever we get from the agencies that we that fund some of this. But it's always difficult to just like any other business at this point, is that keeping afloat and keeping things going. And I think if you try to expand when you're already having some issues trying to get things solidified, I think it's, like Linda says, I think it's off in the future. We're trying to be sure that we give the best that we have right now, and once that's set in cement, then we can look forward to that. But we do have strategic planning that we're doing in terms of what we want to do in the next 5 or 10 years to try to decide which direction we're going to go.
Is it a challenge to find qualified staff? I mean, one here is Vermont's aging population, our demographic challenges and all that, and so you think, well, okay, that means more and more people going to be looking to folks like you for services of one sort or another, and then I find myself wondering, well, where are all these nurses or people who are going to work and make it all happen, where are they all going to come from? Has that been an issue for you yet so far, or have you basically been able to kind of keep and retain a lot of good people, and it's a fairly stable operation?
Well, it is a fairly stable operation. We tend to have a very long-lived staff. We're very particular about who joins us because families are entrusting us with the most precious commodity and the most precious part of their lives. And so we have to make sure that our staff are trustworthy and really dedicated to what they're doing. So when we find the right ones, they tend to stay for quite a long time. So we're very fortunate. We have many staff who are 30 years, 20 years, 15 years. But finding the right person is a challenge, and I think that's going to be a continuingly growing issue because, as you said, the elder population is growing. By 2030, 23.8% of the population in Vermont is going to be over the age of 65. And we are soon to replace Maine as the eldest state in the nation.
Oh boy.
Yeah. Oh.
There's always Maine there.
Always.
Blazing the path. Now we're going to be the pathfinders, huh? Okay.
And so having younger people who will see adult day and human services as a career path is incredibly important. And so really trying to encourage schools and that to really focus that this is a career that can be very, very rewarding for people. Right now, probably not as financially rewarding as, say, going into a different type of business. But hopefully, in the future, as the need grows, that recognition of the incredible professionalism that occurs will bring more people into the career path. But finding the right people is going to be challenging, again, because there are so many options for people. So it's...
How many folks are on your staff at the moment?
We have 23.
23, wow. I wanted to explore that question you had about funding and everything and how people pay for your services. It's mainly through their insurance policy. Is that how it typically works? Like Blue Cross Blue Shield or Medicare, Medicaid? How does that work?
Medicare doesn't pay, but Medicaid will pay if a person is qualified. There's also a sliding scale for private pay. And we have several veteran clients who are covered by the VA.
There's a variety of other funding sources out there, and that's why our social worker is so wonderful about helping families look at affording adult day services if they don't automatically qualify for Medicaid. And then sometimes finding funding that they may need to help support other issues, because many times families are not only struggling with taking care of themselves and their immediate children, but they may be taking care of their loved one who might be coming to BPI. And sometimes they're taking care of their grandchildren. And we see some families now that the intermediate family, so it's the grandparent taking care of the grandchildren. At the same time, they're taking care of maybe their spouse with, say, Alzheimer's or a physical issue. So it's a really interesting thing that is going on in our society where it's kind of skipping a generation and grandparents are caring. And so that's tremendous stress. And so sometimes our social worker is able to find funding and programs for that child, that grandchild. That may not be our purview, but it's our job to help the families as holistically as we possibly can. We're here as an extension of the family. We're here to help the families share the care in whatever way we possibly can.
And we do have a caregivers group too, which our social worker runs, and that meets once a month. And as a former caregiver, I used to attend, and it was very helpful.
So when folks come, do they basically, do you have like sort of groups or clubs that they sort of hang out with, or is it everyone sort of sitting in a big living room and chatting away, reading the paper or whatever, or do they all sort of divide up and go in separate paths?
Well, it really depends on those individuals. Some people come and they make friends They either meet friends that they've never met before, or they see friends they haven't seen in years. And so those friends might stay together, or those new friendship groups might form. But people flow in and out of activities. There's activities throughout our building. And so people can, again, we offer about 25 activities a day. So people can wander into perhaps our living room, and there might be a discussion group going on. And down in the monument room, there might be a more physical activity going on, an exercise class. There might be cooking in our kitchen. There will be a Bible study group upstairs. There might be a group that's gone out to a local store, some shopping trips and tours and things like that. We don't stay put.
So they do go out and
absolutely
drive about. No, very good. I was wondering, I was reading recently some statistics about Alzheimer's disease and dementia. It seems to be kind of a growing thing as people get older and live longer. Are you able to handle folks who have dementia or mental challenges?
Absolutely. We actually have people who have early to end stage Alzheimer's. So they're welcome at all levels. So someone who might have just recently been diagnosed with early Alzheimer's or a cognitive impairment is just as welcome as someone who might be further along in their process. Not all dementias are progressive, and they may need a special assistance. But we can help somebody, again, as long as the family feels the need, and we'll be there to support them, particularly someone in Alzheimer's, from early all the way to end of life. We have people who are on hospice who join us, and we're people who might be within days of passing who are still able to enjoy their life. And they're just as welcome as someone who is very independent and active. We actually offer right now, I hope some people from the North Shire will also join us, the virtual dementia tour. We got a grant from the National Family Caregiver Initiative through the Southwestern Vermont Council on Aging, and we have purchased the rights to offer what's called the virtual dementia tour, and it's an opportunity for someone to experience what it might be like to have dementia for 8 minutes.
Wow.
It's very powerful.
That sounds fascinating.
It's very, very powerful.
Most of the board has gone through that. Right. And I can attest, it is very unusual.
Yes.
It kind of makes you really sort of understand how difficult it is for people that have cognitive and sensory and visual impairment, that to kind of actually negotiate in the world. And when you add in other factors, it really gives you a time to pause and think about how difficult that diagnosis is. And this tour actually gives you a good snippet of what that's like. And I think it brings it into focus to a lot of people.
So what was that all that phenomenon like? I mean, do you just sort of feel like you're not processing information as quickly or as clearly as you think you should be able to, but are not? I mean, is that seems like that's part of it too.
Mm-hmm. It's a very big part of it, because Second Wind Dreams, which is the organization that sponsors this, is really trying to help society understand that dementia and cognitive impairment is not necessarily just a memory issue, that it often is a sensory integration issue, because we experience the world through our senses, and when those are impacted, we're not processing the information as easily as we are right now. So as the insult to the injury to the brain continues, that integration becomes even more difficult. Someone may remember how to button their jacket, but they physically can't do it. But so from the outside, a family member might go, "Oh my gosh, Linda can't button her jacket anymore. She can't." But it might not be that I've forgotten. I just cannot get my brain to remember and my fingers to coordinate to do this. So it's a very fascinating that dementia is much more multi-dimensional than people think.
Yeah. Well, that must be incredibly frustrating for someone to know that they know how to do something and used to be able to do that, and just the signals are just getting crossed somewhere.
And that's one of the things that happened during the tour. I think that when we had a sort of after the tour, we sat down and asked about everybody's experience, and that's one of the things came out of the frustration that they knew that needed to do something, but they couldn't do it because of, I don't want to give away all the secrets, but
right.
right. you couldn't do it for whatever reason, and it was very frustrating. And this is, for us who at this point have good cognition, it's frustrating, but it must be even worse for someone who knows that something just isn't right. And at least we can walk out of it and say, okay, we can go back to our life. But to have that 24 hours a day is can be devastating to some people, especially people that were very high functioning before, and now they're dependent on everyone else.
And I'm sure frustrating on family members and friends as well. So if someone's watching this thinks, wait a minute, that sounds like a great place for uncle or aunt so-and-so, how do they go about enrolling? Or if that's the right term, do they just come down for a visit? And
they can give us a call at 802-442-8136. They can visit our website, www.bpiads.org. They can stop down. We have complimentary visits. We give tours all the time. And sometimes people, may take a little while because sometimes people don't feel like I need that service and maybe a little resistant. I'm not going there. You're not going to put me there because of previous stigma that
right.
or social service organizations or long-term care organizations can have. But once people get down to the Dr. Richard A. Sleeman Center and see that it's a really welcoming old 1785 farmstead, and people can pick and choose whatever they want, and they can participate or not participate, and they can watch or engage, and they can have a wonderful meal. We usually win them over.
And it's not the case that they have to be there like 5 days a week, or they go one day, 2 days, whatever.
And sometimes people come and go. They may use us for a little while, then be gone for a little while, and then they can come back. We're very, very fluid because we're here for them and for their families.
All right, and you had the governor down there not so long ago to help you celebrate your 10th anniversary at your new location, and he certainly seemed to be quite fascinated by all that was going on, and we were having a nice conversation with him afterwards. Well, great. Really great to have you all up here to tell us more about this because, as you said, more and more of us are getting older and older all the time, and it sounds like services like this, like what you're offering, is really a nice sort of step, one less step than going to a full-blown 24-hour residential service, which for some folks probably is what they really need to have, and families would need to have their loved ones looked after 24/7. But what you're offering is a very nice option prior to that. Well, great. Well, Linda Putney, Linda Wichlak, Dr. Budnickas, Dr. Brunis Budnickas. I got that right.
You got it perfect. Most of all, you did.
Thank you all for being with us today, and thank all of you for being with us as well. I hope you have found the show informative and interesting, and we'll see you again the next time. Meanwhile, have a great day. Thank you.